Hello there, and welcome to the Schizophrenia Treatment Exchange podcast. If you've clicked on this podcast, I like to think that you have some sort of interest in mental health, psychology, biology, or maybe even schizophrenia itself. But for those of you who don't know, schizophrenia is a mental illness, and it's typically treated using either psychotherapy, medication, or most of the time it's both. But what makes these forms of treatment so effective? Well, in this podcast, we will aim to find an answer to this question in regard to schizophrenia. So, what exactly is schizophrenia? Schizophrenia is a disorder characterized and differentiated by positive and negative symptoms. But today, we will mostly focus on the positive symptoms associated with paranoid schizophrenia. These are primarily the symptoms of psychosis, which are hallucinations, things that are not real. Now, these can be related to all 5 senses, with auditory hallucinations being the most common, with over 70% of people with schizophrenia being affected by them. Other hallucinations involve visual, tactile, which is your sense of touch, olfactory, your sense of smell, and gustatory hallucinations, which affects your sense of taste. Now, psychosis can also manifest as delusions, believing things that aren't real. But there are additional symptoms such as disorganized speech and or catatonic behavior. Of course, there are many other symptoms, but these are the ones that we'll be focusing on in this podcast. Now, what makes schizophrenia so terrifying? Well, schizophrenia is ranked among the top 10 global disability causes for a reason. Now, imagine this. You're sat at home, alone, and you see someone walk into your living room. It's the devil. And then you hear a deep, menacing voice telling you that all of your loved ones are going to die and it's all your fault. This results in delusional thinking, where you really do believe that this is going to happen. It's a continuous cycle between the hallucinations and the delusions. A person's reality is essentially completely altered. They can't tell what's real or not. And a person with schizophrenia experiences visions and voices and beliefs the same way that any other person does, except they are way more disturbing and petrifying than anyone can imagine. I think if another person who didn't have schizophrenia experienced this, they would be pretty scared of what they were starting to see, hear, and believe, especially when they can't control it. It's essentially, in my opinion, like living a real nightmare. Now, a quick overview on the negative symptoms, since I did briefly mention them before. It's just good to be aware of what they are. Now, these include cognitive impairments and reduced motivation and a decrease in overall happiness. The symptoms that contribute to these feelings are apathy, avolition, alogia, flattened affect, and anhedonia. So, why am I choosing to talk about schizophrenia of all mental illnesses for this podcast? Well, 50% of patients will attempt suicide at one point, and 5 to 10% of those patients will succeed. And in my opinion, these are pretty shocking statistics, which is why targeting the treatment of schizophrenia is so important. Now, schizophrenia is treated with a conjunction of psychological therapies and pharmacological treatments. In this podcast, we will investigate the benefits and the risks of each treatment, whether one is more clinically beneficial than the other, or even if they're better administered together, and why. In this episode particularly, we will consider how schizophrenia varies as a disorder in its symptoms, and whether different psychological therapies have different benefits. So, what therapies can be used to treat schizophrenia? Predominantly, it's cognitive behavioral therapy for psychosis, or CBTP, and that is the first line of psychological treatment. Other treatments involve cognitive remediation, which can help the patient work on their attention, their working memory, cognitive flexibility, and improved executive functioning. But there are other therapies available for people with schizophrenia, such as psychoeducation, which is teaching the patient and their loved ones about their illness, social skills training, which can help improve their social skills and reduce social anxiety, and family interventions, which is simply education for the patient's families. These therapies enable people with schizophrenia to build relationship with others with or without schizophrenia. Another very common and very useful therapy is art therapy, which is usually quite effective. It involves using art as a way of expression. It's especially useful for those with schizophrenia as it helps them interpret their emotions and express them without putting them into words. It's also a great way to distract the patient from their hallucinations. Not only that, but you can also build a little competition with the patients where something will be introduced. For example, a group of people have to draw the same object, and this will immediately increase motivation, and the outcome is essentially building relationships with others. Now, when considering psychotherapy for schizophrenia, it is essential to observe the patient's insight into their illness. Insight means awareness of having the disorder, which according to the International Pilot Study on Schizophrenia, or the IPSS, up to 80% of patients do not believe that they have it. So obviously, if you don't believe that you have a condition, you're not going to seek out treatment for it realistically. This is due to the lack of insight into the disorder, and it's linked to metacognitive defects. But what does this mean? Well, metacognition is the awareness of one's thought processes and the understanding of the patterns behind them. And what causes a reduction of this in schizophrenia? Well, biologically speaking, there is diminished functioning of the prefrontal cortex, essentially the front section of the brain if you look at an anatomy diagram. The prefrontal cortex is heavily involved in mental flexibility, mental abstract reasoning, and self-reflection, meaning that impairments in it could actually lead to the impairment in insight in schizophrenia. So as we said before, CBTP is the most commonly used therapy for schizophrenia. But how does it work? So first of all, let's discuss some things we need to be aware of before treating someone with CBTP. Never engage in anything that devaluates the person's experience with psychosis. For example, take a patient that holds a delusional belief that their spouse is cheating on them. Instead of telling them that their spouse is not cheating on them, state that such a possibility does exist, but there are also many other possibilities. Trying to resist a delusion or hallucination, especially malicious ones, has been proven to increase the frequency of the said delusion or hallucination, as well as an increase in depression. This may actually also make a person more open-minded in their beliefs instead of being fixed on just one belief. So first of all, we're going to look at using CBTP to treat hallucinations. How exactly can we do this? Well, first, it's important to establish what the hallucination is. Is it auditory? Is it tactile? Is it visual? Whose voice is it, or who is it? Where is it coming from? And how does the patient respond to the voice? Try and normalize the voices or the visions that the patient is experiencing, and tell them that hallucinations, any kind, can occur during many stressful events in life, such as insomnia, grief, and trauma, and that they are absolutely nothing to be embarrassed about. The patient may then be more comfortable to share them. Now, the therapist may then use something called the ABC model. The ABC model is basically a way for the patient to identify and evaluate their hallucinations, which eventually helps with the treatment of them. So A represents the patient's thoughts about the hallucination, B represents what the patient feels and does when they experience that hallucination, and C is a list made with all of these experiences. So since hallucinations are uncontrollable and they kind of show up without warning, out of nowhere, it's not always possible to get rid of them permanently. Instead, methods are used to make experiencing hallucinations more tolerable and less scary for the individual. So first of all, a patient may use avoidance and safety-seeking behaviors to cope with their hallucinations. However, this will only make them more scared of the hallucination in the long term. It's kind of like fear. The more that you avoid it, the more it'll creep up on you, only that when you face it, it eventually gets better. So these kind of behaviors are examined, and the patient is encouraged to stop them. The second method is simply distraction. Instead of actively trying to avoid the hallucination, it is better to just try and ignore it. Actively avoiding it will make the brain believe that it is a threat, something to be scared of. Ignoring it, on the other hand, allows the patient to be neutral about the hallucination. They're not trying to actively push it away, more so they will just go about life whether the hallucination is there or not. Furthermore, distractions can definitely help with this, such as listening to music, going for a walk, or even hanging out with your loved ones. The third and more essential method is perspective. Looking at the hallucination through another person's eyes and how they may perceive them is a great way to treat dealing with hallucinations. Forcing the patient to try and change their perspective to benefit them is a great technique to deal with any hallucination. Obviously, this is more of a difficult method, but it's 100% doable with hard work. So, what about using CBTP to treat delusions? Now, the issue is it's very hard to treat a delusion just by proof, due to a bias called the bias against disconfirmatory evidence. This essentially means that despite any evidence given to disprove the belief, the individual will still maintain it. So what is done instead? Well, first of all, we need to evaluate the delusion. Questions can be asked about the delusion like, what is it? What triggered it? And what are you going to do about it? An example of how a patient may react to a delusion is, for example, a patient sees their colleagues talking in the break room at work and immediately believes that their colleagues are plotting something against them. This will then lead the patient to leave the room and isolate themselves. One of their colleagues can then try and convince the patient that they were actually just discussing some documents that their boss sent them by showing them these documents. But the patient might still continue to believe the delusion over their colleague's rationality. They may then find a way to rationalize the delusion in their own mind, such as thinking, oh, those documents were obviously written about me. My colleagues are lying to me. So how exactly can CBTP be used to treat delusions when this bias is such an issue? Well, obviously, the perspective method that I mentioned before for the hallucinations can also be used for delusions. And this is acknowledging that there are many other possibilities for the delusion instead of having just one fixed belief. Like the spouse example I mentioned earlier. This can be sort of seen as disabling something called black and white thinking, where a person sees something as all good or all bad and there is absolutely no in between. But there is a solution to this issue. It's called grey thinking, funnily enough. It's kind of like merging the two together to find the in-between, to find a balance. For example, with the break room scenario, the patient can work on believing that there are many other possibilities, such as those documents could have been about me, but they also could be the schedule for next week, or maybe they're even documents about someone else. Delusions share similarities with black and white thinking, so practicing embracing other possibilities is essential to treating them. So what are the benefits of CBTP? What are their benefits against, for example, antipsychotics? So due to the lack of insight in many patients with schizophrenia, CBTP has been proven to be more effective in patients with good insight, less consistent and more flexible beliefs. But to investigate this further, we're going to refer to a clinical trial that was published in early 2018, but we're going to compare CBTP with antipsychotic medication. Now, you don't need to know everything about antipsychotics to understand the results of this study, but if you want to, feel free to check out episode 2, where we check out their benefits, but also their risks. Anyway, back to the study. Now, this study was a single-site, single-blind pilot randomized control trial in people experiencing psychosis. Now, in this study, there were people suffering from schizophrenia, schizoaffective disorder, and basically any disorder where psychosis was heavily involved. I chose this study to look at because in this podcast, we are looking at the positive symptoms, which has a pretty heavy focus on psychosis itself, so basically the hallucinations and the delusions. So in order to be eligible for this study, participants had to evaluate their symptoms on the positive and negative syndrome scale, or the PANSS scale, so that's PANSS, which is basically a little scale to help with the diagnosis of a psychotic disorder. And we're going to be referring to this as we keep talking about it, so try and remember, we're talking about the PANSS scale here. Now, the PANSS scale is an ascending scale, with 1 being symptoms are absent to 7 being symptoms are extreme or severe. It would be easier to show you guys an image of the scale, but I'm sure if you're curious enough, you'll look it up yourselves. So participants had to score at least 4 on delusional or hallucinatory behavior, which is labeled as moderate, or they had to score at least 5 on suspiciousness, persecution, or grandiosity items to be eligible for the study. Then, 24 patients were assigned randomly to antipsychotics, 26 to CBT, and 25 to antipsychotics plus CBT. And CBT was basically made up of 26 sessions over the course of 6 months, with up to 4 booster sessions if needed. And the choice and the dose of the antipsychotic were up to the psychiatrist. And participants were followed up for a year. So what were the results? So the overall mean baseline PAN score was 70.4, so that's 70.4. And to have made minimal improvement, there should have been a mean reduction of 15 points in the PAN scores of the patients. So did this study succeed in that? Well, there was a mean change of 13.3 in the antipsychotics group, a change of 12.3 in the CBT group, and a change of 13.4 in the antipsychotics plus the CBT group. So we were close, but unfortunately the 15-point threshold was not reached. But some improvement is always better than none. Now, the issue with schizophrenia is the heterogeneity of the condition. So this basically means that each patient suffers different symptoms to an extent. This makes the disorder even more complicated. For example, one patient may have strong grandiose delusions with minimal auditory hallucinations, whereas another patient may have recurring visual hallucinations, but their delusions are inconsistent. Some patients may have an episode every single day, but some may have one once every 3 months or even twice a year. Other patients may suffer from other issues such as depression, which they may even consider to be more of an issue than the psychosis itself. So CBT really differs for everyone, and it's essential to know how to treat each individual patient. Furthermore, there were some limitations to the study. Well, there are always limitations to studies. Some patients refused talking therapies, and some didn't always take the medication when they needed to. Furthermore, the dosages of the antipsychotics were also risky, as the dosage didn't always have an impact on the symptoms, but increasing the dosage may have made side effects more likely. And due to this, the patients may have even dropped out because the side effects could have gotten so severe that they wouldn't have wanted to progress with the study. So obviously, this study made it seem like CBTP probably isn't best for those with schizophrenia. But then again, what if that's just to do with the insight issue that I talked about earlier? A lot of patients with good insight don't take medication for schizophrenia and instead use therapy, whether it's their own or a psychologist's, to treat it. So, since CBTP may not work for everyone with schizophrenia, what other options are there? Well, as I've mentioned, antipsychotics can really benefit some people, and a combination of antipsychotics and CBT may be even better. Sometimes one antipsychotic won't work as well as the other, and sometimes the dosages do have to be adjusted, but once a patient finds one that works for them, they can be really beneficial. And finding little things to motivate you is also a great way to improve your mood. And of course, a support system is always good. These can really help alleviate the symptoms of psychosis, or more so, make them easier to deal with. Surrounding yourself with those who will love and support you is crucial. Sometimes it's easier said than done, but if you have it, hold on to it. There are also community therapies for people with schizophrenia, whether it's a support group or even an art therapy session. So, what can we conclude from this episode? Well, CBTP does have great benefits, but for certain patients. As schizophrenia is such a heterogeneous condition, it won't always work for everyone. Maybe this is due to poor insight or embarrassment of symptoms due to the fear of being judged. Maybe new psychotherapies need to be founded to target the disorganized thinking, the insight issues, and the metacognitive defects. But of course, if talking therapies do not seem to work for the patient, there are always the other options. Finally, what can we do as the public for schizophrenia? Well, trying to reduce stigma is a huge one. Talk about schizophrenia, educate people on it, and call them out when they say something harmful. And just listening to those suffering with no judgment whatsoever, and as much support as you can provide. Making the world an easier place for people with schizophrenia will always be important. It'll make them more comfortable to speak out about their symptoms and hopefully easier to access the treatment that they need. The statistics that I mentioned at the beginning of the episode can not only be lowered with better treatments, but also with as much love and support as you can give and as we can give as the public. Thank you so much for listening to this episode. It means the world to me if you did, and especially if you stayed right till the very end. Thank you so much. If you wish, head on over to episode 2, where I sit down with a real psychiatrist to discuss biological treatments for schizophrenia. I'll see you soon!